I'm Jessica Kemp, Vice President of the Center for Planning Excellence based in Baton Rouge, Louisiana. Thank all of you so much for joining us today. I know many of our lives are crazier than ever, so we really appreciate you sharing your time with us. For those who may not know CPEX, I'll give a little history and explanation of how we came to this moment in this webinar. The Center for Planning Excellence is a nonprofit planning organization that works across Louisiana to advance our mission of bringing people, culture, and planning together to make great communities happen. We work with state and local governments, communities and neighborhoods, and philanthropic and nonprofit partners to advance smart growth and healthy community design, climate change adaptation, and equity and community engagement in plans and planning processes. Over the past several years, CPEX has been increasing our focus on how our built environment, which is largely the result of planning decisions and regulations, or lack thereof, affects public health and many of the social determinants of health, and how we can address many of our top public health concerns: obesity, asthma, diabetes, heart disease, some types of cancer, just to name a few, through healthy community design. So we've been thinking a lot about how designing 20-minute neighborhoods, places where you can access quality, affordable housing, transit, bicycle and pedestrian infrastructure, parks and green spaces, healthy foods, healthcare, and economic opportunity, and connect to these types of daily destinations in 20 minutes or less. As the coronavirus pandemic has progressed, we are seeing even more ways that healthy community design impacts a person's ability to be resilient, their ability to stay healthy, avoid spreading the illness, and manage the closures and economic disruptions. As it was becoming clear that COVID-19 was taking hold in Louisiana, CPEX reached out to UrbanFootprint, whom we had worked with before to create the Louisiana Speaks plan after Hurricanes Katrina and Rita. In just a few short weeks, CPEX and UrbanFootprint developed the COVID-19 Insights platform. We learned from the Governor's Office of Homeland Security and Emergency Management that food insecurity was quickly emerging as a major issue for Louisiana. Of course, we wanted to help, so we put the Insights platform immediately to work to assist the critical work of the Greater Baton Rouge Food Bank and Feeding Louisiana. We're continuing this work and intend to apply the Insights platform to other issues that are critical to our state's recovery as well. So today, with our guest speakers, we will be discussing the rapidly changing landscape of food insecurity in Louisiana, how food insecurity intersects with other issues that also create vulnerability, and how we can use data, mapping, and other partnerships and resources to address the issue of food insecurity and other issues that will also be critical as we navigate what we hope will be an equitable and resilient recovery from the COVID-19 pandemic. So we have 3 experts with us today to help us dig deeper into the food insecurity issue. Each of our speakers have a long list of professional achievements, and we are very grateful to have them with us today. In the interest of time, I will provide only a short introduction to each of our speakers, and they can add other details as they see fit. So I'll start with Dr. Candice Myers, who is the Director of the Social Determinants and Health Disparities Laboratory at the nationally renowned Pennington Biomedical Research Center here in Baton Rouge. Her research currently focuses on food insecurity as a key social determinant of health and source of health disparities. Dr. Myers also studies the impact of place on health disparities and has extensive expertise in modeling geographic disparities in obesity and diabetes prevalence across the United States. Korey Patty is the Executive Director of Feeding Louisiana. Korey is an MBA and brings years of experience in business and economic development, public policy, and advocacy to his position. In prior roles at Louisiana Economic Development and Southern Strategy Group, Korey worked across a variety of industries, managing policy and advocacy efforts, and was appointed by Governor Jindal to serve on the Louisiana Healthcare Commission. And we have Joe DiStefano, who is CEO and co-founder of UrbanFootprint. He brings nearly 25 years of experience in urban planning, mobility, and disaster response and recovery. His focus is on implementation of actionable, data-driven tools that bring critical information to land use planning decisions, energy and water resource choices, and the environmental, public health, and social equity challenges of our times. So thanks again to each of our speakers for being here. And before we jump in, I have just a couple of housekeeping points to share with everybody. We are recording today's conversation. CPEX will make it available on our website and YouTube channel after the webinar. Participants, your mic and video will be off throughout the duration of the webinar. However, we do want to hear from you. We've reserved the last 15 minutes of our time together for Q&A from participants. So please enter your please enter your questions for our speakers in the chat. This can be found at the bottom of your screen, and we will get to as many as we can during the Q&A. All right, let's get started. We can begin by giving each of our guest speakers a few minutes to talk about their organization and their findings and experience with food insecurity, and then we'll move on to other questions. And we'll start with Joe. Joe, I know you have a presentation prepared. Will you tell us a little bit about UrbanFootprint, your connection to Louisiana, and then I know your presentation shows us some of what you found so far using the Insights platform to unpack the food security issues here in Louisiana.
Yeah, absolutely. Thanks everyone for being with us, and thanks for the opportunity to talk with y'all. As Jessica noted, we go quite a ways back working in Louisiana and with CPEX in particular. We were part of the Katrina Rita response team in 2005 and co-authored the Louisiana Speaks Recovery Plan that focused on how to recover and build back stronger in Southern Louisiana. We're a software company that serves what we call an urban intelligence platform to public agencies, urban planners, NGOs, and private enterprises. Our team is actually a pretty interesting mashup of experts in urban planning, development, equity mapping, and emergency response in particular. And we combine that with top Silicon Valley software engineers and data scientists. Our tool set, called UrbanFootprint, provides highly directed insight, and that's really key, insight to policymakers, cities, nonprofits, and enterprises. We as an organization have been focused on the health of cities and the people within them for more than 25 years. We were born out of a leading urban planning, design, and disaster response practice. We worked around the world and the US in building and deploying what came to be known as a sort of SimCity for real tool set that helps the public and policymakers understand current conditions, which is a real data-driven exercise, and the impacts of development and policy interventions, or different scenarios, if you will. So now we serve that tool set to practitioners and agencies across the US. And that's what we're deploying to unpack the COVID-19 crisis and how it's impacting people on the ground. And so as Jessica pointed out already, early discussions with state officials in Louisiana, as well as on the ground relief providers and food banks, made it very clear that access to healthy food is a deepening challenge in the state and across the country for that matter. And so we've really focused our initial efforts in supporting policymakers and direct providers like food banks with data and mapping to improve relief efforts. With that, I'm going to just pop over, if you just give me 1 second here, I'm going to pop over to our presentation and get moving. You should be able to see my screen. All right. Give me a second to work through the administrative mechanics of all this, and then we'll be off and rolling. All right. So really, this has been a crisis where we've all focused deeply on numbers. We focused on curves, on flattening of curves. And this is good because from numbers and from data comes more understanding about a disease, about how it's transmitted, and ostensibly about how we're doing in combating its spread. We've also focused on the second order curves that have risen in the wake of response to COVID. The unprecedented unemployment that's moved pretty much really honestly like a tsunami across the landscape, and the rising social distress curves that really don't seem to be flattening. This pandemic has spiraled into a series of interwoven health, economic, and social crises that threaten to undermine the capacity of the public institutions that are traditionally charged with addressing them. So as we think about how to deploy limited resources into what sometimes seems like a sort of increasingly unlimited problem set, it's important to step back from the big picture, from these big numbers, and think about the people behind those numbers. And that's really the crux of the undertaking today, and what we're really focused on for subsequent weeks and months. The crisis is unprecedented in its scope and scale. It's touching more people and more Americans than any other in memory in countless generations. Take food security, the focus of today's discussion. Food security is impacting more than 80 million Americans today. That's a dramatic increase of more than 25 million people in less than 2 months. So, the sort of scale of change here is really unprecedented. But what's critical here is that the intensity of the pain on this crisis is not felt evenly. So economic stress and food security are spread far and wide, absolutely. But when we actually peel back the onion and really hone in on cities and communities, it's evident that where we live really matters, and it matters more than ever for our social, our economic, and our health outcomes. Those with pre-existing social and economic vulnerability are experiencing deepening pain, and unfortunately are going to find it harder to recover unless resources are deployed to prevent the bottom from dropping out in particular communities. And that's really what our partnership with CPEX is really focused on. It's helping agencies and relief providers understand not just the scale, but the distribution of this crisis in order to understand how to prioritize resource distribution and intervention to where it's needed most. We're building out and actively developing a new data and analytics platform, as was mentioned, an extension of the UrbanFootprint software designed to provide direct insight to agencies and frontline organizations. So this COVID-19 Recovery Insights platform, it serves both strategic needs and also supports direct intervention. It is very specifically not just another data platform. It is really aimed at impacting how we intervene. We're already working with state task forces, local governments, and food banks to help them unpack where and how the crisis is impacting people on the ground. But also, very importantly, we're helping to build better battle plans to attack the challenges and working directly with food banks and relief providers in order to address those issues. So the platform itself, just very briefly before I get into the analysis, is powered by a series of social vulnerability, economic stress, health, and accessibility indices, which are built to inform really where critical services are needed across and within American cities and across Louisiana. The indices now combine static data about land use and transportation systems, demographics, things that sort of urban planners are sort of the bread and butter of urban planning, with increasingly dynamic data within this crisis, things like jobless claims and spending patterns, COVID-19 caseloads, transit service disruption, things that used to change on 6-month, yearly cycles are now changing week by week. These indices provide an evolving view of the challenges facing cities, and they can be used alone, by an economic development agency, for example, or can be used in combination to evaluate challenges at multiple scales and to design and test specific interventions. So this brings us to the food security crisis. And due to this escalating food access crisis that we're here to talk about today, the indices were deployed as the backbone of a statewide food security index. So we created an index that will support agencies and cities and food banks across Louisiana. Now, this index lays out the evolving scale of the challenge by evaluating a combination of different socioeconomic factors, which I'll dig into in a little bit more detail in just a second. It looks at things like jobless claims and economic stress indicators, pre-existing health conditions, access to grocery stores and healthy food, and it combines them to show both how the pandemic has increased the number of people facing challenges in Louisiana, but again, very critically, it's the where, it's the distribution of food security across the state. And this is really critical in understanding, again, both the scope and scale and distribution of this issue across communities. So let's start with some of the pre-existing conditions. So this is sort of a first view, what we call the social vulnerability index. And this takes a look at things like income and poverty and age and race and household type, housing tenure, access to vehicles, things that are sort of traditionally looked at when we understand the underlying factors in a community, access to opportunity and underlying vulnerability. So as you can see here, about 1.25 million of the residents of Louisiana are on what we consider like the top 20% of the social vulnerability index. These are places that are where the impacts of this crisis are likely to be amplified or are already being amplified, places that are less resilient, if you will. And so being able to very quickly understand the scale of that and the distribution of vulnerable communities across the landscape is really step one. And in many cases, this is a generations-old pattern, and one that is, in many cases, really amplifying the underlying impacts, the impacts of this crisis. And so we look at this both from a state scale, but also very importantly, we can hone in and look anywhere in the state and start to think about and look at and design intervention around the distribution of this vulnerability. So these darker purple areas across the map, and as we hone in and look block by block, are places that are more likely or are already experiencing more pain due to this crisis than other places, the lighter colored places on these maps. So we now add to that that sort of underlying understanding of social vulnerability, what we call an economic stress index. This now takes a look specifically at some of the underlying economic factors around income and poverty, rental and housing burdens, and other sort of traditionally focused on economic factors, and adds what is now a very, very dynamic landscape. So we typically jobless and unemployment numbers change, by 0.1% month by month, and even 6 months by 6 months. We're now looking at massive changes in jobless claims and unemployment, distributed very differently across this landscape based on sectoral concentration. So we really wanted to be able to parse that in order to evaluate economic stress across the landscape, but also how that, again, is distributed. So if you look at, this is the pre-COVID condition. So in the pre-COVID condition, about 1 million, or nearly a quarter, of Louisiana residents were already living in areas that are considered economically stressed. Again, these are places that are ultimately going to be more vulnerable to crisis. And so this is that first view again. What we can now start to do is look at some of the dynamic factors that ultimately impact economic stress today. So I'm just going to move through a series of slides here that shows how unemployment has shifted. And again, this is about we all know that the numbers are big. We know that there are more than 600,000 claims across Louisiana. The question, though, is where are those claims concentrated? And thus, where do we need to deploy social resource, job training, and other resources in order to address sort of the underlying factors and help communities sort of build back, if you will. So prior to March, Louisiana was looking at a statewide unemployment rate of just under 7%. You can see about 1,400 claims coming in the week of March 7th. You can watch these numbers shift, and also watch how different portions of the landscape get darker and darker pink. After the stay-at-home order directive was issued on March 20th, you see these numbers start to jump very rapidly, and particularly in places where you've got high concentrations of retail, hospitality, tourism, and other service-oriented industries, which have been hit hardest, and particularly in the early days were hit the hardest. So you can see unemployment spiking dramatically. And as we start to make our way across the weeks, this is just 2 months worth of data. Looking out to March 28th, we're looking at 170,000 claims. That jumps by another 100,000 in the following 2 weeks. You can look at New Orleans employment, looking at roughly unemployment at about 30%, 40,000 claims. That number continues to rise, and starts to spread itself as this entire map becomes pinker and pinker, as it starts to spread itself and concentrate in specific areas as well. So here we are by around the week of May 9th, just under 600,000 claims. Unemployment in New Orleans over 50%. Unemployment in Baton Rouge mid-30s, and you can see the numbers across the landscape. So this is unprecedented in its scale. It's unprecedented in the pace at which this occurred, and it is unprecedented in its concentration. So what happens is those dynamic indicators flow into an updated view of economic stress. So if you recall, we were looking at about a quarter of the population living in what are considered economically stressed areas, moving up to nearly 4 million, or upwards of above 80% of Louisiana residents living in areas that are considered economically stressed today. That is an intense shift, and one that is going to require very directed intervention in order to address sort of some of the climbing out of this crisis. And again, it's not just about that statewide view, but being able to parse and get down into specific areas and understand which parts of which cities across the urban and rural landscape, because this is not just an urban issue. This is a decidedly rural issue as well. Which parts of the, which specific neighborhoods and which particular areas across cities are likely to need additional help. And in many ways, these are leading indicators of a food security issue, right? So people who are unemployed today might need food assistance tomorrow. And so areas that have traditionally needed food assistance need it even more. But there are also areas across the landscape, which we'll see shortly, that are sort of newly vulnerable from a food security perspective. We also look at underlying health conditions that are particularly sensitive to access to healthy food and food security issues. So this is looking at things like age and disability, underlying health conditions like diabetes, heart disease, other components, whether or not there's health coverage, and you can see how that distributes across the landscape as well. So actually, pre-existing condition, nearly 50% of Louisiana residents are living in areas that are considered high risk from an underlying health perspective. So a substantial challenge from the get-go, and one that's intensified as COVID spreads across the landscape. And then the last subcomponent of the index here is accessibility. And so this is where we look at specifically the ability to get to healthy food options. So this looks at age and disability. This looks at access to vehicles. And this specifically looks at things like walk access to food outlets as well. So this sort of combination of factors, which can make folks far more insecure when it comes to food. And so we'll get into how all these things combine. And again, being able to parse that, look at it on the landscape. I'll peel back this onion much further in just a few slides as we look at how we can specifically intervene to address some of these issues. But this combination of sort of urban form, sociodemographic, underlying health, and economic factors combine in a composite to help us understand the scale, and then again, I keep honing in on this, the distribution of the food security challenge across Louisiana. So here we sit at the pre-existing condition. This is the pre-COVID food security picture. So we're looking at, just over 1 million residents in Louisiana living in areas that are that are deemed sort of food insecure. In this case, defined by being in the top 20% of this food security index. And you can see how that's distributed across the landscape. And highest numbers in larger cities, but it is distributed. Northeastern Acadiana, seeing substantial challenges from a food security perspective pre-crisis. And then also important to note is that number in the middle there, 35%, nearly 400,000 of the most insecure are in unincorporated areas and rural areas and cities under 10,000 people. And I know these are areas that the food banks are specifically, really focused on and are also very challenged because the crisis is really distributed. So this is the precondition. This is the post-condition. So green is better here. Red is worse, is more insecure. So I'll go back again. You look at those, lots of orange areas turning darker, green areas transitioning to red. So we're now looking at an additional 500,000 people, or 1.6 million total, living in areas that are deemed food insecure for the, based on those previous factors we discussed: underlying social vulnerability, additional economic stress, poor access to food, and underlying health conditions. An additional nearly 250,000 insecure people in rural and unincorporated areas, and then substantial increases in the major cities and areas across the board. There is almost no area of the state that has not been touched by a substantial increase in food insecurity, most of that driven by the rolling increases in economic stress and jobless claim increases. So we can look at that and we can distribute this. And this is when you start to step back and say, okay, from a state resource perspective, or from a general resource distribution perspective, where is the challenge most substantial, and where have we seen substantial upticks in the challenge? You can see, for example, New Orleans moving from the number, moving from 5th, which is still not a great position, but moving up and seeing, more than 75,000 additional people in the past 7 to 8 weeks living in insecure areas. So you can look at this in different ways, and we've parsed it in different ways in order to support different agency and relief provider perspectives on this crisis. And so when you look at that same set of ranked numbers, so ranging, going from Monroe at number 1 down to Metairie at number 10, you can see that the dominant sort of driver is unemployment rates. So you can see places like New Orleans going from a roughly 9% pre-COVID unemployment rate to greater than 50% today. That is the driving force behind food insecurity in this particular case. This incredible increases are really the driving force. It's not just limited to large cities. We're taking a look at how this impacts small cities and rural communities across the state, and we're also parsing this into some of the groups that are most likely to be impacted: seniors, children, and others. And so, I'll take you. We'll do a quick tour through some of those issues as well. And again, it's about breaking this down, looking at areas across these communities, and this is where we start to get into a level of detail, or we can start to work directly with and support food banks, Feeding Louisiana, and others, and not just advocating for resources, inadequate resources, but really thinking about how to specifically deploy onto the ground interventions that address the different issues across the landscape. Just briefly taking a look at some of the groups that are most susceptible, and this is actually emerging directly from conversations and discussions that we've been having we and the CPEX team been having with food banks and providers on the ground, really wanting to parse this further back and think about interventions and thinking about the scale of the issues around seniors, for example. So this is the pre-senior food condition, and this is the post. And right now we're looking at greater than 30% of seniors in Louisiana now living in food insecure communities, increasing by more than 60,000 since the crisis began. So you're looking at now more than 200,000 food insecure seniors, and 55% of them live in small towns or unincorporated areas. So that's specifically challenging from the perspective of being able to meet the needs of those communities. We can parse these and look at these in different ways. And again, these are different ways to deploy this information in ways that can impact ultimately an intervention or a resource distribution. Here we can see that East Baton Rouge and New Orleans are home to the highest numbers of seniors. And then places like Caldwell Parish, Alexandria, and Claiborne have the highest percentage of seniors in food insecure communities. And this might help to start thinking about where we need to be addressing these issues sooner rather than later. We can also break this down and look at this from the perspective of the youngest. And this is the breakdown of child food insecurity, whereas the pre-COVID condition at 26% of Louisiana children living in food insecure areas is now rising to more than 35%, nearly 400,000 children, an increase of nearly 100,000. About 50, again, similar number to seniors, 56% of newly insecure children live in small towns and unincorporated areas. 45% of them are single family households, and 135,000 of them with children under 12. So this is and that kind of doubles the challenge around food insecurity. So pretty substantial issues. And again, looking at how that's distributed across the landscape. I'm going to do a very quick dive into sort of peel back the onion a few more layers and think about how we can use this kind of platform, if you will, to impact the battle plan, the actual sort of intervention. How might we use data to support specifically like a food bank's activity, a food pantry's activity, a city's activity in addressing the sort of increasing severity of the food security crisis in cities. So here's Baton Rouge. And we can take a look at the pre-existing condition where, in this case, more than 50% of residents are in areas that are deemed low food security based on the combination of factors that we've talked about. We've seen a substantial increase in insecurity driven, as noted before, by the increasing sort of jobless claims and economic crisis. And specifically, you look at areas that have high concentrations of service sector and retail and hospitality employment. Those are the places that are becoming darker red faster. And we can actually do that same ranking now and start to look at neighborhoods. We can look at shifts across neighborhoods, and we can start to deploy those unemployment rates, and we can estimate how they're being deployed down to the neighborhood level, which really helps us understand from a leading indicator perspective where we need to be deploying resources. So this is something that we believe state resource agencies and regional and local agencies, as well as providers, can be using to inform how to distribute resource and specific interventions. But if you peel this back a little bit and you look, for example, here's Baton Rouge. Here's that same set of sort of food security. Here's food security today, right? So here we're looking at a roughly about 65% of residents living in the metropolitan region, looking at living in food insecure areas. Those are grocery stores. So those points represent places where you can access to healthy food. So this is not a liquor store. This is these are grocery stores. And what we really want to start doing is start to parse access to healthy food across this landscape. So here's an analysis. This is called the network access analysis. And those lightest colors on the map are areas that are within a 10-minute walk of those grocery stores. So about 200,000 households in the metro area do not live within a 10-minute walk of a grocery store or food outlet. And that may not be such a big issue if you have access to a car, or if you're higher income, but if you don't have access to that transportation, it becomes a very specific issue. If transit service is disrupted due to COVID or social distancing, that becomes a very specific, a very poignant issue as well. And so here's now this overlap between those food insecure areas and grocery store locations. So those red zones now are areas that are deemed food insecure, and those dots are those grocery stores. These darker purple areas are now areas that are greater than a 10-minute walk to a grocery store and are food insecure. And so these are the areas that are at highest risk, and the people within those areas are at highest risk from a food security perspective. And so we can now take a look at that. Now turn those yellow. So there's about 38,000 households that fall within these areas in the Baton Rouge metro. So this is not within a 10-minute walk of a grocery store and have low food security. These are people that do not typically have access to vehicles, and have other underlying factors that make them food insecure. So these are areas where we might want to target response. Let's hone in on North Baton Rouge. So what if, for example, we were to add schools to the mix as distribution points? And this is sort of getting into some of the tactical decisions that we can support. So if you look at schools, for example, here around North Baton Rouge, that's the sort of half-mile radius around them. Those blue dots are schools. If we add schools to the mix, we actually reduce at-risk households by about 14,000, right? So the blue areas now are the places that we have improved access to healthy food. So if you use food as distribution points, for example, schools as distribution points, we can add churches and religious organizations. And I'm not saying all these pink dots would necessarily do that, but just being able to turn on those pink dots, ask the Insights platform, what if we choose schools? Now we've knocked another 13,000 households out of the high risk category by those pink zones there. And so anyway, that's just a sort of general overview here, but I think the main point here is that we want to be utilizing data. We want to be utilizing this comprehensive information in order to build a layer cake, or multiple layer cakes, if you will, so that we can understand the scale of these issues. Food security is just one of them that we're facing right now, but understand the scale of these issues, and then also very critically, how these issues are distributed across the landscape, and how underlying urban, social, and economic factors are impacting how this crisis is felt on the ground. So I'll stop there, and I look forward to the conversation today.
Thank you, Joe. I'm turning my mic and camera back on. Okay, thank you so much. And so Joe has given us a very dynamic and detailed picture of the food insecurity problem in Louisiana. Korey Patty with Feeding Louisiana and many others with nonprofit organizations providing direct services have been witnessing this on the front lines, and we want to hear about what they're seeing. So I want to give Korey a few minutes to tell us about Feeding Louisiana and how the food insecurity situation in Louisiana has been evolving since the COVID-19 shutdown.
Yeah, thanks, Jessica. So I think that was a great introduction by Joe, just kind of looking at the things that our folks have been seeing on the ground for the last two and a half months or so. As an introduction, Feeding Louisiana is the State Association of Food Banks. So we're here in Baton Rouge representing our 5-member food banks who are regionally located across the state: Shreveport, Monroe, Alexandria, Baton Rouge, and then Second Harvest headquartered in New Orleans and with a satellite facility in Lafayette. So the network, the total network, including those 5 food banks and the more than 900 partner organizations and programs that they work through in all 64 parishes of the state, serves to help folks in need to meet their food assistance needs. And the last couple months have been a real challenge for us. I think, it's important to talk about the work that the network does in blue skies and the level of need that is out there across the state. So Joe, I think mentioned where we were pre-COVID. All of our members are Feeding America food banks, and we work closely with Feeding America in data collection and programming and food sourcing, so on and so forth. But one of the things that we know from our partnership with them, studies that they've done, including Map the Meal Gap, working with some other partners, is that upwards of 750,000 people in Louisiana deal with food insecurity every day. So I think what Joe's tool and Urban Footprint's tool highlights is areas of the state where folks could be living with food insecurity, and ours kind of drills down, looks at the people that are living in food insecurity and dealing with that issue regularly in their lives. One of the things I know that we have to talk about sometimes is that kind of small difference between hunger and food insecurity, right? So where hunger is that thing that pops up for everybody. If you miss a meal, you're going to be hungry, but food insecurity being that chronic condition of basically not having the resources that you need to steadily meet your needs. So, where we look at the 770-some thousand people across the state, we recognize that Louisiana is one of the states in the country with the highest level of overall food insecurity. Joe mentioned those particularly vulnerable populations of children and seniors and food bank programming that we have specifically geared towards those groups, try to meet the need that exists there. But we don't, as a state, we don't fare a whole lot better in terms of food security for those groups either. Where we're coming in pre-COVID, again, we were somewhere around 1 in 4 children, 1 in 4 Louisiana seniors that would be classified as food insecure. We know that number has increased dramatically, and we may be looking at a situation where it's much closer, if not higher, than 1 in 3 children. One of the I think what's important and what our folks have done over the last couple months is doing a lot of that tracking that Joe has mentioned. So we're steadily watching the unemployment application numbers. We're steadily watching the applications for assistance through SNAP, and that kind of guides what we see on the ground as well in terms of what the level of need is across the state. So, for a couple weeks there where we were seeing unemployment applications of 90,000, 100,000+ applications submitted to the state, where compared to a year ago at this point where we saw 1,500 to 1,600 applications being submitted. So just an incredible level of increase there that really signifies the situation that a lot of folks are in and the hardships that a lot of people are experiencing due to the spread of coronavirus. I think for us, we've had to kind of parse things out a little bit as it relates to spread of the virus, impact of the virus, and then that economic impact too. So Feeding Louisiana we get to wear a couple hats. One, in representing the food banks and the network, talking about the work of the network and the work of food banks, pushing food through communities, through our partner organizations, community and faith-based organizations, but also recognizing that we are disaster response organizations and disaster response workers, even in blue skies. So it's important to know for those 770 some thousand people, they are experiencing the everyday disaster of hunger. The spread of COVID-19 and coronavirus has certainly exacerbated that situation for those folks, and it brought several hundreds of thousands of new people into a vulnerable situation and food insecurity. But this is the work of food banks, and I think our folks are certainly experts in responding to that need. Flexible organizations that are able to work with community partners, work with community leaders, and identifying a solution that best meets the needs of individual communities. So talking about the work of food banks is one of the things that we get to do, that we do, especially in these times, as we've increased probably our advocacy around the efforts of food banks and some of the challenges that have popped up, whether that's with the state's feeding task force, advocating to state agencies, including Department of Ag and Forestry, Department of Children and Family Services, but then also our federal partners working with the congressional delegation, with USDA on a number of programs that they have. And I think that kind of gets to that second hat that we get to wear, which is our advocacy and policy work. One of the things that we talk about a lot is the recognition that we have that food banks aren't the end all be all of hunger response and the anti-hunger industry, if you will. We have a role to play, and it's significant, having those ties to communities, and like I said, being able to flexibly respond to needs and concerns of communities and populations across the state. But recognizing that the federal programs that aid in this work, the other not-for-profits, the business partners that support the work of food banks, all of us have a role to play. The volunteers have just been incredible in our operations and a critical part of that. So all of us as a community, as a state and a country, have a role to play in the fight against hunger, the fight against food insecurity. One of the things that we talk about regularly is looking at the capacity of food banks as compared to the capacity of SNAP. There are some proposals on the table right now in Congress that would increase the benefit amount for SNAP recipients at a level of 15%. And one of the things that we have to take on a lot of times is education around these programs and around these benefits. So for a lot of people, I think it is not necessarily common knowledge that the minimum SNAP benefit is $16, and that's an amount that a lot of seniors living in food insecurity are often receiving, just based on some of the resources that they might have available to them. So small amounts, and then looking at larger families too. So what is the need that program is able to meet? Big picture, for every meal that a Louisiana food bank is able to distribute, and we're pushing out 70 some million meals, more than 70 million meals annually across the state, SNAP supports 9 meals being put on the tables of individuals and families that are in need. Its capacity is just so much larger. And then supporting the economy too, with folks being able to take those benefits and use them in grocery stores, folks being employed in those grocery stores, the economic impact that SNAP dollar has. So, there's a role for us to play. There's a role for these strong federal programs to play. And I think for us at Feeding Louisiana, especially over the last couple months, has been talking about how to improve the work of food banks, but also looking at the importance of these federal programs largely. So that's SNAP, that's the Federal Commodities Program, TFAP, so many acronyms, right? But CSFP is a program for seniors. The Summer Food Service Program for children, especially as we approach this time where children aren't going to be in school, have not been in school for the last couple months, certainly. But we know that that is a period of the year where our state typically struggles, and a lot of children have increased needs because they're not able to rely on those meals that they count on, breakfast and lunch, through the school system. One of the things that we have to talk about and have to point to and keep reminding folks of is 70% of Louisiana's public school children are on free and reduced lunch benefits. So that's, an overwhelming majority of school children and then their families too that are short on resources and living with food insecurity. So our work has been varied, and we can certainly talk about what the response has been as we get to it into the conversation, but largely recognizing that there are kind of these not competing but collaborative efforts that take place. Food Bank, the network itself is built on partnerships, those traditional partnerships through churches, community centers, emerging partnerships through healthcare organizations, recognizing that diet, nutrition, food security are just terribly important and critical to the health of children, seniors, adults, employees. So, recognizing, looking at the partnerships that we have in place there. And then I think over the last couple months, we've seen a ton of new partnerships pop up, as well as we've seen the challenges around food security across the state have become more evident. And I think that's a positive thing, not only for this response, but gives us the opportunity to continue the conversation going forward. Really appreciate being able to work with Joe and his team at UrbanFootprint, because I think this tool gives us the chance to really depict what the need is out there. We talk about the experiences of food banks, understanding what the challenges of communities are, but especially these visuals and this kind of deep dive into the challenges of folks in our cities, in our rural areas. These are difficult topics to parse. So the information that they've been able to call, and then us being able to work together, I think, in addressing this challenge over the coming weeks as we get through this, the coming months, and our expectation is, that we're going to be in this work for a long time. I think we've seen over the last couple recessions and challenges to the state and national economy that it takes a long time for us to get back to a steady state. And some of the significant unemployment numbers that we've seen across the state, we know that those things aren't just coming back full bore, that folks across communities are going to be experiencing these challenges for some time. So our food banks are kind of buckling in to meet the significant level of increased need that we've seen over the last couple months, and that's going to be our work for some time. So again, happy to be part of the conversation and looking forward to the rest of this event.
Thank you, Korey. That was a very sobering overview of what food insecurity looks like in Louisiana. the increases in need are just staggering. I think so. The next kind of phase of our conversation addresses this, that food insecurity doesn't come out of nowhere. There are contributing factors, and then there are impacts beyond just, being hungry or not having access to food. So, Dr. Myers, I know Dr. Myers has had some technical difficulties. Have you been able to join us?
I am here. Can you hear me?
Yes, wonderful. So, Dr. Myers, what I'd like to ask you is to tell us about your work leading the Social Determinants and Health Disparities Lab. And you might, I think probably a lot of people by now are familiar with what social determinants of health are, but you might include just a quick overview of that. And tell us what kinds of things you're looking at and how they're connected to what we're seeing with the food insecurity issue that's emerging amidst the pandemic.
Sure. I apologize for those technical difficulties, and I think I'm just going to move forward without a camera right now, if that's okay with everyone, so we can at least hear the few things that I have to say.
Sure.
Sure. So here at Pennington Biomedical Research Center, one of our labs, the lab that I lead, is the Social Determinants and Health Disparities Lab. And the specific things that we focus on, just as Jessica mentioned, are the social determinants of health. And while I'm sure the audience is largely familiar with what social determinants of health are, these are typically considered to be the economic and or social conditions that influence a person's health. And so we can think of this at the individual or person level in terms of socioeconomic status. So things like income, education, type of occupation, employment status. Those things are really important for shaping someone's socioeconomic resources. We can also think of social determinants of health from a larger, maybe more place-based perspective. So where a person lives in terms of their neighborhood or community does have a direct impact on their health. And these things are important because very often social determinants of health kind of underlie or even potentially drive health disparities. And so we know that there are differences in health status based upon where a person lives, based upon their socioeconomic status. So that's really the broad focus of most of the research that we do here in the lab. Specifically, in more recent years, the primary focus has been on food insecurity as a social determinant of health. And the reason for that is here at Pennington, our primary objective that really unifies all of the research that we do here is combating and addressing the obesity epidemic within our state, within our region, and really, worldwide. And we know that obesity is a really important health issue in our local communities and in our state. And when we think about food insecurity, we also see that it's a very important issue that many people in the area face. What's really important and somewhat interesting when we think about food insecurity as a social determinant of health is it's very often related to poor health status. And in particular, there's a lot of research that has shown that food insecurity or being food insecure is really associated with or linked to a higher likelihood of also being overweight or obese, as well as suffering from diabetes and poor cardiovascular health. So with these things in mind, the research that we really do focuses better on kind of quantifying the relationship between food insecurity and poor health, and really answering the question as to why food insecurity is related to poor health. First and foremost, just as Korey mentioned, food insecurity directly impacts a family or an individual's diet and the nutrition. It impacts what they're able to consume. And so we know that what people eat is directly important for their health status and in particular for their weight. And so when we really want to think about addressing the obesity epidemic in our region, we cannot do that without considering that so many of our residents also suffer from food insecurity. And so if we want people to potentially be healthier, lose weight, better address their diabetes, we also may need to consider that many of these people also are food insecure, and this may complicate their ability to actually be healthy, to actually eat the things or afford the things that we would like for them to eat in terms of nutritious fruits and vegetables and access to healthy food. And so when we think about the current economic crisis, really that's been brought on by COVID-19 and the significant uptick in food insecurity, I think one of the things that's in the forefront of our mind here at Pennington is while we're trying to address the obesity epidemic, what we are potentially seeing with this uptick in food insecurity is that we also may now have a new set of health complications or health consequences that we need to think about and consider, especially for the long term. When we really want to address the health of our residents, that we need to understand that what we're currently going through in terms of this economic crisis really may have far-ranging implications for the type of research that we need to do here and the things that we need to incorporate into our perspective in terms of actually addressing the obesity epidemic. So, and relating this back to what Joe said during his presentation, these underlying health issues, these underlying health conditions, this is exactly what we're doing here at Pennington, is really trying to better understand why there is the link between food insecurity and obesity, or food insecurity and diabetes, so that we here can also address or develop interventions that incorporate some consideration for people potentially being food insecure when we're trying to improve their health. So I'll stop there.
Thank you, Candice. So I think you present a really interesting conundrum that food insecurity can be linked to obesity. We know that Louisiana already has a huge obesity problem. We consistently rank amongst states with the highest obesity rates. CPEX has done a lot of work with different partners in North Baton Rouge, and we hear again and again that having access to a full service grocery that has, fresh produce, healthy foods is a huge issue. I would like any or all of our speakers to talk about the grocery store issue as one of those place-based challenges for people who are food insecure and also for combating obesity, but also to talk about what are other contributing factors to food insecurity. And I also am wondering, do those factors change as you move from urban to rural contexts? And if no one speaks up, I'll pick on somebody. Korey, let me start with you. What do you all observe, or are you able to observe some of the contributing factors to food insecurity?
Yeah, I think with the scope of coronavirus, this is like I mentioned before, like the regular work of our food banks. But we've seen this before too, right? We talk about the brief government shutdown last year that pushed a lot of people into food insecure situations, and just kind of recognizing that there are a lot of Americans and a lot of Louisianans that live on the edge of some hardships as it relates to their own personal economics and financial situations. What we saw last year was a lot of government employees, a lot of government contractors in stable jobs that missed 1 to 2 paychecks, and then it was a real hardship and a challenge for them and their families to try and keep food on the table. So seeing an increase in need as it relates to that situation, I think largely it comes back to resources, right? So we're a high poverty state. We are a largely rural state as well, and we see those things kind of dovetailing to create a bit of a perfect storm, not only in this situation, but kind of in our everyday work too. Food banks are working. Our folks are working diligently to try and get a better solution around those challenges that are presented for food insecure folks living in rural areas. Just with our distribution model and partnership model, it is critical that we have organizations and partners that are able to take on a lot of that work. And I mentioned, the incredible work and value to the network that our volunteers represent. So that might be at a church in, let's say Opelousas, Louisiana, that has a number of volunteers. They have a regular distribution. What we've seen over the last couple of years, and as the landscape around rural America really changes, is a shortage of some of those viable partners, some of the partnerships that we've had in place, just kind of scaling back their availability. It might be a once a month distribution instead of once a week or every other week, something like that. So I think one of the things that we are trying to work through right now and comes back to one of the values and benefits of UrbanFootprint's tool is looking at organizations in those locations that could be viable partners for the network, but also some of the larger scale programming too. So I mentioned the summer food service program. In a lot of places that's run by school systems. So schools will obviously serve meals during the school year, and then they'll continue that work during the summer so that children in need know where they can go to get a meal in an accessible place that they're familiar with. So what this tool, the Insights tool, could allow us to do is to be able to say, okay, these are food insecure communities, using the insight that we have as food banks on the ground to be able to kind of co-locate either distributions or recognizing that there's just gaps in service in particular places. And I think that's probably kind of how we move forward with that work.
Okay, thank you. That I want to ask the same question of Joe with UrbanFootprint, and Joe, maybe ask you to also think about long term, the factors, especially those that are part of the built environment contributing to food insecurity. How could we use the platform to think about how we design communities and how we invest resources and infrastructure to improve food security and health outcomes?
Yeah, it's a good question. Starting maybe at the beginning there. I mean, I think that to Korey's point, so many people are sort of riding the edge, and we're already incredibly sensitive to just the smallest increase in stress, if you will. And I think what we've been able to map, at least now, is that like very large portions of the state have tripped over into stressful position, which in this particular case makes them very vulnerable to food insecurity, and then the ripple effects that sort of roll off of that, and being able to, and then digging into specifically how to intervene in very different environments. right? I mean, I think, and that's really where frankly, the partnership with, Korey and the Baton Rouge Food Bank and actors on the ground is absolutely critical. And so that's where what we want to be able to do is very specifically they're the ones asking the questions, right? It's Korey asking the questions. We're helping to provide a sort of a landscape, if you will, to understand the problem, to understand the scale, and in some cases to advocate for the kinds of resources that are required to address a situation that is so out of scale compared to the resources being deployed towards it. I think that's a really critical message to be able to clearly articulate to actors at multiple levels, whether they be federal or state or philanthropic or whoever. We have a very substantial issue across the country, but very even more intensified in Louisiana based on some of these underlying conditions. So then it comes to, okay, I mean, I think, and we had this experience, right, a couple of weeks ago. We start working very specifically down on the ground, and you start to realize that, like, wow, could we peel back the onion a little bit further to understand the rural situation in more granular detail than we typically can, to understand the senior situation, the sort of child food insecurity situation. And what we start to do then is we start to lay down, those points that we showed, which were in the case of the slide deck I showed, were schools. If you start looking at the school distribution in the rural portion of the state, and you look at the proportion of students that are on the school lunch programs, and that we're relying on schools to deliver healthy food, and then you can very clearly articulate and begin to understand the geographic scale of the rural food security problem. And what that does is it starts to trigger a whole new series of questions as to how to address that problem through intervention. And I know you all are already working on things like, mobile food distribution. And then what happens when mobile food distribution intersects with another COVID resurgence, intersects with so-and-so. And so our job really here is to help to understand, like, how you can layer those different components on to help drive, in one form or another, a more effective intervention, and to drive a more efficient use of very scarce resources, and ultimately get more resources. Anyway, that's the sort of big picture. But I do think when it comes to your other question, which is related to this, which is how can we understand the specific components of urban environments, and how can we actually address the weakness in those certain components in certain urban environments in order to get at some of the underlying urban and socio-demographic factors that ultimately result in food security today and tomorrow and next month and next month. And yeah, it's absolutely a combination of sort of deep-seated, generations-old socio-demographic and other sort of resource distribution issues, but there are also a subset of those that can be addressed through, or at least partially addressed through how we design communities and how we recover within communities, and where we distribute our resources towards underlying infrastructure in communities. So, for example, one of them, which is clearly urban form oriented, is the walkability, the underlying walkability of a place, right? The ability to walk to basic services. Some of those basic services that most of us take for granted are things like grocery stores, medical clinics, today, testing sites, right? Essential workers are concentrated in certain neighborhoods that are being most hard hit. Where are test sites in relation to where they live? So you have essential worker concentrations that happen to also in many cases overlap with places that have very low access to automobiles, and might, for example, be a mile and a half away from a testing site, which isn't a big deal if you have access to 3 vehicles. But if you have access to 0 vehicles and transit service is disrupted, or you don't want to get on transit because you don't want to get COVID, then how do you get to a testing site? And then how do we address our testing issues? That's an urban form. That's a community design issue, as well, and a walkability and a resource distribution issue, as well as a sort of social or medical issue. So how you distribute sort of social infrastructure at the base of a community, whether that be schools or community facilities or medical facilities or test sites or food distribution sites, those are things that need to be built into our communities from ground zero, as opposed to sort of amended onto our communities in the midst of a crisis. And so, how we design place and how we design social interaction and making sure that people have access to open space and adequate open space so that they can recreate in the time of social distancing and concern. That is also not equally distributed across the landscape. So how we design our communities from the ground up is critical tomorrow, today, yesterday, and is being sort of made even more poignant by a crisis in which certain people have access to, I can go take a walk in my regional park. But people who live 2 miles from me have nearly no access to places in the same way. And that's a community design issue. Sorry, lot to unpack there.
Thank you. Sorry, the unmute takes a second. Thank you, Joe. I think that's really helpful in thinking about how community design actually intersects with these issues. And so I want to pose another question about intersections to Candice, if she's available, or she could at least maybe start us off. But, we've kind of started an impromptu partnership here between UrbanFootprint and CPEX and the Greater Baton Rouge Food Bank and Feeding Louisiana. And I wonder then how, are there other examples or models or aspirations for how planners and on-the-ground nonprofit organizations and then research institutions like Pennington can work together to expedite relief in a crisis like this, and or inform strategies for a long-term recovery that starts to chip away at some of the underlying issues that create these vulnerabilities during times of disaster in the first place?
Sure. In terms of kind of partnerships between community groups, community planners, and for us here at Pennington researchers, I think one of the things that comes to mind is partnerships that are potentially built around intervention development and research opportunities in terms of we certainly here at Pennington and other research groups have the data and the literature and the research that potentially speak to the development and the formation of interventions and actually implementing interventions that may have some specific or unique aspects about them. For example, just off the, kind of anecdotally, well, what if we were to build an urban community garden in this place? What type of effect would that have directly on kind of the immediate consequences of how people feel about their food security status and their eating behaviors? And then from that, by forming that partnership, we can obviously put into place a very a really tight research plan about how we're going to measure all of these components, successfully implement something like an urban community garden. And then we're going to see how that actually impacts those residents who potentially live in that area or actually participate in the community, the urban community garden. And those are some of the things that we actually do here at Pennington by way of forming partnerships with community groups, is that, a lot of stuff is actively going on in our communities to improve people's lives by way of, any number of avenues. Off the top of my head, there's potentially opportunities for urban housing that's being built, and urban housing that has considerations given to workforce development and continuing education programs for adults, and then improved health outcomes for children. We're working with groups like that so that we can almost perform these types of natural experiments, so we can observe what's going on, understand the health implications, and then take what's really working, what's really having a positive impact, and then either take it to a larger scale or add another component to it, measure that again, so that we can really fine tune and find the best ways, the most effective ways to address whatever the issue may be. And so there's been some work like that here at Pennington, and there's certainly work in progress that's happening. And it's great when community groups can partner with a research institution to kind of have these symbiotic relationships where We're trying to find answers to questions that really have direct relief within the context of our own communities. You know, so much of what we do at Pennington sometimes doesn't feel like we're touching the people in our community, certainly in near time, but we want to develop things that also have long-term implications and have input from our community members. So.
Thank you. That's so helpful and important. Candice and Joe, just quickly, is it possible to incorporate the kinds of findings that Candice describes into the Insights platform? Like if they conduct an experiment and learn that urban garden has this effect in this radius, then is that the kind of thing that could be added to the model?
Yeah, absolutely. I was thinking exactly the same thing. I think what something, you know, and this is where, you know, I think what the platform can really do, I think more than anything, is increase access to cutting edge research like was just described, right? So and that dramatically increases the scale of its potential impact. So ultimately what we want is something that, you know, to democratizes, if you will, access to the kind of information that ultimately leads to, you know, more effective intervention and more equitable resource distribution. One of the paths towards that is, you know, the best data and the best research providing defensible narratives about the issue and defensible connections to interventions that work. And so if we can do that and scale that and scale the impact of that great research, then that's absolutely what we should be doing. And that is really what in so many ways, UrbanFootprint and the platform itself is really sort of built on that infrastructure. And so, yeah, that would be the kind of thing we would very much look forward to collaborating on.
Great. Well, hopefully we could maybe talk more about that later. I have a long list of questions for our speakers, but it is time for us to transition to our audience questions. And so I want to make sure that these get ample attention. So I'm going to pivot and start sharing some of the questions which are right on point with the direction of the conversation. I'll start with one about urban farms. How effective are urban farms such as Grodat or Baton Roots at combating food security or providing for better access to healthy fresh foods? This is probably a question for Korey or Candice. Do you have any information on how well these work to improve food access?
Thanks, Jessica. So I think our folks, the food banks across the state, work with programs like this pretty regularly. And the challenge is just scale, right? So for Greater Baton Rouge Food Bank comes to mind, their fresh food, healthy food initiative, where they are doing distributions of fresh produce, fruits and vegetables based at partner agencies that don't have the capacity to store those things. So, you know, if you've got a church pantry that does a distribution once every 3 weeks, they're not going to be able to keep much fresh produce on hand because it needs to go out quickly. For those organizations that don't have space or funding for large refrigerators or freezers, you know, they're in the same position. So our member here in Baton Rouge does kind of just-in-time distributions of those fresh items to be sure that folks in the community and folks in need are getting those things. I think everybody recognizes that increasing fresh produce consumption across the board is a key to better health outcomes. So that's kind of a next frontier for our folks. making progress and doing work in that arena. But I think largely the challenge is just scale and capacity. I mean, we've got so many folks that are dealing with those issues. I know that, there are some interventions taking place related to community gardening, related to education around improved diet and improved nutrition. So the challenge, I think, for us and for all the folks that are participating in this work is just expanding that messaging and being able to, a lot of times, shift culture, right?
That's not easy, huh?
No, it's difficult.
Thank you. Candice, do you have anything to add to that? Has Pennington had any findings that speak specifically to the efficacy of urban farms?
While I can't think of any research that we've done here at Pennington that has utilized that type of an urban farming component, just, in the literature, certainly from other places that are publishing their research, urban farms, community gardens are certainly seen as kind of components of improving health for individuals who are low income and food insecure, who do not have readily available access to affordable, healthy, nutritious food. And I think just for the reasons that Korey just mentioned, though, I think there's some individual level implications and educational components to consider when you incorporate something like trying to increase healthy fruits and vegetable consumption just across the board. I can think of a food pantry that I have worked with specifically here in Baton Rouge, and that food pantry was attached to a nonprofit and a church, and the church itself had its own garden, and so they were able to provide fresh fruits and vegetables on a regular basis to that food pantry, which is really great. And so it increases the availability that clients were able to have in terms of fresh fruits and vegetables. But just for the reasons Korey mentioned, if you don't have the space and the refrigeration to actually maintain those types of food items within the context of a food pantry, it may be more difficult to offer that to clients. And then also in terms of food pantry or food bank clients actually making decisions about the foods that they choose. If they happen to go to a client choice food pantry or food bank, again, that's where education has to come in, because even when we grocery shop at a grocery store, we all have choices that we can make about healthy and fresh produce, fruits and vegetables. But we also know the grocery stores can offer some pretty unhealthy foods as well. And, there has to be an educational component when we consider actually kind of encouraging or hoping that people will consume more fruits and vegetables.
Thank you. And that is a perfect transition to another question coming from one of our participants, which is what policy approaches in institutions and government could incentivize healthy food consumption and or create disincentive for zero nutrition sweetened products that then create domino effect health problems. So I think to summarize, are there things we could do at the policy level to encourage consumption of healthy foods that might work in tandem with some of these built environment improvements?
Yeah, I'd be interested to hear Candice's take on this, but I'll mention SNAP again. One of the things that we have to be mindful of is largely dignity in the process, right? Especially for low-income clients that need assistance, and we've seen a number of proposals, and the idea pops up every so often that how do we kind of tailor SNAP specifically so that people are buying things that are either better for them, or how do we cut out those things that we deem as not healthful. The challenge there really, I think, is both administrative, and having to go through all the SKUs that a grocery store might stock and figuring out which ones fit the program, but also, looking at a family and the difficulty of telling a child or, a parent that they can't go and use resources, those benefits to buy their child a candy bar when they're in the grocery store, something like that. But I think, we mentioned the proposal that's on the table related to SNAP increases. These are choices that all of us are making based on the resources that we have, the familiarity that we have with the things with food, especially that we've come into contact with. And if you have more disposable resources, you have the opportunity to try more new things, to be able to take something from the grocery store and say, hey, I don't know what this is, but I'm going to give it a shot. If I don't like it, if my kids don't like it, then, so be it. But we, especially as it relates to children, we know that children have to, I think, try new food 11 or 12 times before they truly become comfortable with it. So one of the programs that some of our food bank members participate in or deliver, along with LSU Ag Center, Southern University Ag Center, is SNAP Ed. So that's really, making that introduction for a lot of more healthful foods, fresh produce, fruits and vegetables, to a population that would be SNAP eligible, so that when they're using those benefits and going into grocery stores and making their purchasing decisions, there is some of that education that's taken place, so you can know, all right, what is this new food that maybe I wasn't familiar with? What can I do with it? How can I prepare it? Where is it available? Kind of going through all of those things. But, having the resources, having those benefits that are available to folks across the country to be able to afford those things is critical too.
Thank you. I want to, there's a question I want to ask Joe from one of our participants that I think is important, because we've talked about this a little bit in our team meetings. This person wants to know, is the Insights platform publicly available?
Yeah, I mean, the intent is to, right now it's being, used behind the scenes to support agencies and to support food banks. But ultimately, this is about sort of long-term capacity in Louisiana. It's about transitioning a substantial portion of this capacity into the hands of CPEX and ultimately larger communities. So we are currently seeking to substantially expand the project in order to address this very issue, which is to sort of build out a component of the platform that makes this information easily available by non-technical actors. And in some cases, this means someone on the ground at a food bank being able to very quickly ask some of the questions that we've been talking about today. Some of those sort of deeper studies that I showed in the slide deck, making those accessible. What if we did this? What if we did this? What if we did this? We want to be able to provide that call and response mechanism. So ultimately, the answer is yes, I certainly hope so. And we're looking to resource that so that we can push this. And in the meantime, we're really heavily focusing our team in being able to answer the specific questions that a frontline relief provider asks, answer them in near real time, because the crisis is unfortunately unfolding in real time.
Yeah, thank you. And I just want to add that as a partner in this project, CPEX also, that is the vision that we share for this to be something that is widely accessible, and I think that contributes to transparency and we're in the capacity building piece as well, which I think is tremendously important for Louisiana's nonprofit sector and our government agencies. So I think we have time for one more quick question, and this question I think speaks to some of the points that Korey made about the need for flexibility as needs are growing so exponentially, so rapidly. And resources are limited, then the need to be innovative and flexible to kind of meet needs as they emerge. This question asks, have any school districts in the state used school buses for distribution of meals rather than having families drive to or go to a central distribution points. So that's a very specific question, but I wonder if you could speak to that and any other kind of innovations on the traditional model that have been tried.
Yeah, I think everything's on the table right now. So I mentioned the food bank's traditional distribution model and working through partner agencies. What we've seen, especially in the early days of the spread of the virus, was closure of a lot of partner agencies as folks, were rightfully afraid of contracting the virus, and also a decline in the availability of volunteers. Just the way that it goes, a lot of food bank volunteers are older and in that high risk population. So really seeing a decline in the availability and the numbers of those folks. So that kind of necessitated bringing more things in-house. We've been really fortunate over the last couple months to have the support of the National Guard. And that's a kind of a blueprint that we've seen across the country, with National Guard being able to support food bank operations, recognizing that there's a lot of food that needs to be packed, a lot of food that needs to be distributed, thousands of cars potentially coming through a mass distribution. So, there are crowd control aspects that need to be managed there. So they've been really useful, but all of those things are on the table. One of the stories that we heard from SFSP last year distribution, or 2 years ago, I think, in a children's cabinet meeting, was just that. So partners, organizations participating in the program, loading food up onto a bus and then being able to drive through communities and do specific drop-offs, or kind of that mobile pantry, mobile distribution model that a lot of people really appreciated, especially as there are barriers to access, including transportation challenges. What we've seen, though, is you really need champions for these efforts. So unfortunately, the story from a couple of the organizations that are doing this and had great experiences serving their communities was, this is what we did. We loaded the school bus, we drove around, we dropped them off, served this many people. And then the person who was running the program, took another job, moved to another organization, and it fell apart. So I think it's important for us to recognize that this is a significant issue and a real need in our state, and then kind of build our organizations and our capacity to support interventions that make progress on this challenge.
Thank you. And I think that was very well put, and we're out of time. So also a nice call to action to end our webinar on. There's so many more questions. I feel like this has been a really rich conversation, and there's more to be said and more questions to be answered and asked, but we will be respectful of everyone's time. I want to thank our speakers again for joining us and sharing their time and expertise. And I want to thank everyone who's logged on to listen and participate. So thank you very much, and I hope you all enjoy the rest of your week.
Thanks all.
Thank you.